Your Royal Highness, esteemed organizers of the 2026 Prince Mahidol Award Conference, and distinguished participants and guests, it is a great honor and privilege to speak to you today. Thanks to the organizers of PMAC, to Dr. Vicharn, Dr. Suit, and Dr. Chunratai, for inviting me to speak to you about my second favorite topic, the informal economy. My favorite topic, as with many of you, is Lincoln and my grandchildren, one of whom, Natalie Chen, is with us here today and works in public health. I want to address a critical challenge at the intersection of demographic transitions and equity. Namely, how do we extend inclusive social protection and provide essentials to informal workers who number about 2 billion, who power our economies and provide essential services during normal times, as well as during crises and demographic transitions. According to the International Conference of Labor Statisticians, informal workers are those workers who do not receive social protection through their work, either because they are self-employed and cannot afford the premiums, or because their employer does not contribute to their social protection. So defined, the informal workforce is very large, representing around 60% of all workers today, a total of 2 billion workers. It is also heterogeneous, including many, if not most, of those who produce, process, and distribute our food, build our homes, roads, and cities, stitch and embroider the garments and shoes we wear, weave the textiles and create the handicrafts we enjoy, produce the footballs and other sporting equipment we play with, assemble the electronics, and package the pharmaceuticals that we depend on, provide us transport services, sweep and clean our homes, roads, and public spaces, collect, sort, and recycle the waste we dispose of, and provide us a range of care services, childcare, elder care, and health care. Yes, in many countries, most healthcare workers, other than doctors and nurses, are informally employed. These informal workers are on the front lines of our demographic transitions. As our populations age, who cares for the elderly? As extended families fragment and women enter the workforce, who cares for children? The answer? Paid informal care workers who themselves lack health insurance, retirement security, and childcare. As young people enter labor markets, where will most of them work? Mainly in the informal economy. As people migrate across borders and from rural to urban areas, where will they find work? Overwhelmingly in the informal economy. During COVID-19, we, the global community, came to value the essential services of informal workers, banging pots and pans in appreciation. Post-COVID, we have largely reverted to not seeing or turning a blind eye to this large and largely invisible global workforce. My remarks will draw on the experience and evidence of the global network WeGo that I co-founded in 1987. WeGo is committed to increasing the voice of informal workers through stronger organizations and greater representation, and increasing the visibility of informal workers in official statistics and policy analysis. WeGo believes that statistics and informed policy analysis in the hands of workers is power. Empowering informal workers to challenge the dominant negative narratives about the informal economy that stand in the way of inclusive policies. My remarks will be in 3 parts. I will begin with the false predictions and negative narratives about informal employment. I will make the case for inclusive social protection for informal workers, and then describe briefly a shining example of inclusive social protection for the informal workforce, namely Thailand. 50 years ago, experts predicted that informal economies would transition to formal ones, that welfare states would proliferate, and that development for all would be achieved by 2000. These predictions have simply not come to pass. Today, 60% of the global workforce, 2 billion workers, are informally employed. Meanwhile, fewer than 30 countries are welfare states, and most social protection systems cover only formal workers. In response to these challenges, the global community committed to pursuing first the MDGs and then the SDGs. But meeting these goals, especially those related to poverty and employment, have proved elusive. I posit that one reason for the elusiveness of the goals is that not enough attention has been paid to the fact that low and middle income country economies are largely informal, and that employment everywhere is increasingly informal, even in developed countries. Think gig workers. The global community needs to develop a global development strategy that recognizes this reality and supports, rather than undermines, the informal economy. But here's the paradox. Globally, 2 billion workers are informally employed, while only 400 million are unemployed. Yet, unemployment remains the most widely cited labor market indicator. We should rightfully worry about unemployment, especially as over 1 billion young people will enter labor markets over the next decade. But if we're serious about reducing poverty and inequity through demographic transitions, we must equally focus on extending social and legal protections to informal workers. However, many policymakers subscribed to negative narratives about the informal workforce, that informal workers seek to avoid regulation and taxation and are non-productive, despite evidence to the contrary. These dominant narratives undermine the extension of social protection to the informal workforce. A particularly troubling and dominant narrative asserts that social protection systems which combine state-subsidized social protection for informal workers with contributory social insurance for formal workers create a perverse incentive for workers to choose informality. But I ask you, what is more perverse? That some workers choose to be informal when offered subsidized social protection, or that 60% of all workers globally lack social protection. The solution to this complex challenge requires not just political will, but also a change in mindset. A change to a mindset that recognizes and values the contribution of informal workers and seeks to extend social protection to them. Fortunately, this is not just aspirational. As far back as 1938, Japan recognized the need to extend community health insurance to farmers. And in 1961, when it was still a middle-income country, Japan achieved universal health coverage that included self-employed informal workers. And more recently, in 2011, Japan added elderly care insurance. Thailand is another shining example of a country that has recognized and extended social protection to informal workers, and done so through a unique partnership of government with civil society. Thanks to a collaboration between Thailand's National Statistics Office and HomeNet Thailand, which I will speak about shortly, and I must say with early technical support from WeGo, statistics on informal employment in Thailand have improved. At the end of 2024, in Thailand nationally, the unemployment rate was around 1%, while the informal employment rate was 67%, meaning that 2 out of every 3 Thai workers are informally employed. As many of you know, Thailand has a robust public health system, including a universal health coverage scheme. Since the early 1900s, the Thai royal family has championed health and related services for the Thai people and founded medical colleges. After studying medicine and public health at Harvard University, Prince Mahidol, whose legacy this conference honors, played a major role in improving medical schools and health services in Thailand. And since the 1970s, the government in Thailand has invested in health delivery infrastructure at the district level and below, and on training the health workforce. A notable feature is that all medical students are required to work at the district level after receiving their medical degrees. In early 2002, after a participatory political campaign, a universal health coverage scheme was introduced, using general taxation to finance the scheme after an initial phase of 30 baht contributions by the non-poor. Later that same year, the National Health Security Act was introduced. The UHC includes not only health insurance, but also primary health care, as well as health prevention and promotion. And around 1 million community health volunteers across Thailand help link communities to these integrated health services. The next frontier is to strengthen elderly care insurance in Thailand, as 20% of the population is now over 60. Without retirement security, elderly informal workers must continue working, including as paid care workers for other elderly people, and this is not sustainable. To better respond to its rapidly aging population, Thailand has recently launched an initiative to integrate non-clinical health workers and non-professional care workers into the formal health system. What many of you may not know is that the Constitution of Thailand contains a provision that allows 3 entities to propose a national law or bill: the cabinet, members of parliament, and citizens. This means that civil society organizations can propose legislation to be debated in Parliament by gathering signatures from at least 10,000 eligible voters. Thanks to this provision, embodied in a 1997 law, civil society was heavily involved in the campaigns for the Universal Health Coverage Scheme, the National Health Security Act, and a special article for informal workers, Article 40, in the Social Security Act of Thailand. And civil society organizations continue to be actively involved in national and district level implementation and monitoring committees. Also, since 2008, the Thai government has convened an annual National Health Assembly that brings together civil society, researchers, and government to address the challenge of UHC design and implementation. What Dr. Prawaz Wasi, the legendary Thai doctor who recently passed away, called, quote, the triangle that moves a mountain, unquote. Arguably, this unique government, academia, civil society partnerships accounts in part for the fact that the private sector plays a relatively limited role in the health sector of Thailand. To understand how that triangle works, let me briefly share the organizing and advocacy work of HomeNet Thailand and the Federation of Informal Workers in Thailand. And I want my Thai colleagues to stand up while I speak. As Punsip Tulapan, director of HomeNet Thailand, recently stated, quote, one of our main roles is to organize home-based workers and other informal workers. We have helped establish the HomeNet Thailand Association and the Federation of Informal Workers in Thailand. We collaborated with 10 networks of community-based and civil society organizations to collect approximately 60,000 signatures to submit a proposal for the National Health Security Bill. As a result, the National Health Security Law was enacted, and representatives of civil society organizations serve on the National Health Security Board, unquote. But systemic change means little if it doesn't transform actual lives. The Federation of Informal Workers in Thailand has 10,000 members from different occupations: home-based workers, domestic workers, street vendors, and motorcycle taxi drivers. You've seen the last 2 groups. The others remain a bit more invisible. What does Social Security mean to a street vendor who falls ill, to a domestic worker whose own children need care, to a motorcycle taxi driver who is injured, to a home-based worker whose husband falls ill? Kanakwan is president of the HomeNet Thailand Association and a home-based worker who produces bronzeware, articles made from bronze. She recently testified, quote, "I have been a member of HomeNet since its early days. When HomeNet invited us to discuss proposing the National Health Security Act, I immediately saw how beneficial it would be. We therefore worked together to collect signatures in support of the bill. When it finally passed, I felt deeply relieved and grateful. My husband has poor health and becomes ill frequently. Eventually, he developed a bloodstream infection. Without the gold card, our family would have had to pay hundreds of thousands of baht for his treatment. However, with the gold card, we only paid a small out-of-pocket amount. We did not have to struggle financially. The gold card saves the lives of poor people, prevents families from falling into bankruptcy, and allows us to live with dignity." Unquote. This transformation from vulnerability to security, from invisibility to dignity, is what inclusive, equity-centered policy looks like in practice. Punsap and Kanakwan have showed us how workers mobilized, how democracy can work for the marginalized, how a triangle moves a mountain. Going forward, as populations age, as young people seek livelihoods, as families restructure, and migration accelerates, we as a global community face a fundamental choice. We can continue to design social protection for the 40% of workers who are formal, while leaving out the 2 billion informal workers who feed us, build our homes and cities, and care for our children and elderly without social protection. Or we can follow Thailand's example of an inclusive transition towards universal social protection. Thailand shows this transformation requires statistics that make invisible workers visible, democratic mechanisms that enable citizen participation, political will to invest through general taxation, partnership between government, academics, and organized workers, what I call public-people partnerships, not the usual public-private sector partnerships, and ultimately, the recognition that every worker's dignity matters. So please join me in congratulating the Thai royal family, the government of Thailand, medical professionals, the health workforce, academic scholars, civil society activists, and worker leaders across Thailand for jointly creating this shining example. I also wish to honor the memory of Dr. Pawas, Thailand's legendary public health scholar and civil society leader who passed away on January 10th this year. Dr. Pawas was the visionary architect behind the triangle that moves a mountain, the partnership of government, academics, and civil society that made Thailand's universal health coverage possible. His legacy of community empowerment and participatory reforms lives on in every informal worker now protected by Thailand's social security system. As we leave this conference, let us commit ourselves to asking not just how do we achieve health for all, but how do we also ensure that informal workers who make health possible, the care workers, the cleaners, the food vendors, are themselves protected. In sum, the demographic transitions ahead demand nothing less than the full inclusion of 2 billion informal workers who sustain our economies and our societies. Thank you.